washing is the number one most important thing when we get started on our procedures, okay? So I'm gonna go ahead and do that. Okay, and our next step is gonna be identifying our patients. So we're asking them, what's your name and your date of birth?
Virginia Escamilla, 12/23/82.
Perfect, and then we are going to be doing a blood draw on you today, so are you okay with that?
Yes.
Perfect. All right, so then we would check a requisition form. We don't have one, but normally that would be either the labels printing out or an actual requisition form. Just depends on where you're working, okay? Then we are gonna put our gloves on. We're selecting the tubes next, so I will be selecting the tubes for you guys, but regular order of draw would be good, but I grabbed a blue and a purple one, okay? So just to show you guys interchanging. Next, we're assembling the equipment. And we always do that in front of our patients so that they see that it's a brand new needle every time, okay? Next thing we're doing is we're positioning the arm however we feel comfortable, and the patient can be comfortable as well, okay? And we're tying the tourniquet. Palpating for that vein. We already found it. So the next thing we're doing is we are cleansing the site in concentric motions. And we're letting that air dry, okay? And we're retying that tourniquet, so we're ready to go. The next thing we're doing is we were holding our needle in the correct position, 2 fingers under, thumb on top, okay? Then we are anchoring our vein for insertion, okay? We are grabbing our tubes in the correct order of draw. We make sure that we are in that 15 to 30 degree angle for drawing, okay? And she should be nice and dry by now. Insert that tube. We want to change the tubes nice and smoothly. Then we're releasing that tourniquet before that last tube is done. Pulling out the last tube. Then we put the gauze over, and then we put pressure on, and we activate that safety, okay? And you have your patient hold that for you, okay? And then we are going to dispose of our needle in the sharps container, and then we're inverting our tubes, okay? The next thing we're doing is we're labeling first name, last name, date of birth, the date that we drew, the time in military time, and your initials, okay? Oh, I didn't grab tape. Then we go ahead and check the site just like that. And then we're gonna dispose of all of our equipment. So that would include our tourniquet and any other supplies that we have. And then we remove our gloves. And then we tell our patient, thank you, have a nice day. And then that is it. So do you guys have any questions?
I do have a question. When
Yeah.
when we
And that's